looked at his teachers union, looked at the public sector union boss and said, "You guys gotta be kidding me. $73,000 as an average yearly paycheck and a 16% raise over 4 years, and you're gonna walk out on 350,000 children? You gotta be kidding me." But that's the way America will go if we don't all stand up. So thank you for your leadership, and I need everyone to stand up for that type of leadership.
Well, thank you for your encouragement, too.
Yeah.
Could you say something why this activist judge thought that this law was unconstitutional? I think it's just incredible that would come about.
I believe, now I probably would be the last person this guy would want to speak for him, but I believe the activist judge decided this was unconstitutional because he is an activist judge. And oftentimes, activist judges are unaware of the fact that they, in fact, sit on the judicial branch and their job is to interpret law and not make it. They should leave that to the legislative branch, which, of course, is a different branch that our founders put into the Constitution. And if it's codified in the Constitution, we in Wisconsin stand behind it. Thank you all very much. Appreciate it a lot. Have a wonderful weekend.
Please welcome Twyla Brace.
Well, good afternoon, and thank you, Phyllis, for inviting me. I'm just thrilled to be here. You see, we have an opportunity together to do something really big. So I'm glad to be here with you because I get to talk to people who are from every state in the union, and for what I'm trying to accomplish, I need people from every state in the union. Now, yesterday, President Obama said one of the key reasons he wants a second term is because he wants to finish health care. Well, he may want to finish putting Obamacare into place, but I want Obamacare finished. I want it gone, I want it repealed, and I want it dead. Now, until that day, however, we must do what we can do to keep it from being implemented. And we can do this. We can accomplish it, and we can blow the president's plan right out of water. So that's where you come in. The power to stop Obamacare is not in Congress. It's in the states. And the way to stop it is by stopping the health insurance exchange. I'm going to explain to you what the health insurance exchange is so that you can understand that the exchange is Obamacare. And even better, without the exchange, that you can stop Obamacare. There will be none. So here's what I know. I know that most of you probably have no idea what a health insurance exchange is. But this has worked in President Obama's favor, as his administration has provided more than $1 billion to start up the exchanges, and he has slated almost $1 billion for next year to continue to build them. In an article this week, Robert Lazuski, president of Health Policy and Strategy Associates in Virginia, said the following: "The ACA cannot be implemented without an insurance exchange in each state. It's a go or it's a no-go. It's that simple." 2 years ago, a similar statement was made. Terry Gardner, National Policy Director for the Small Business Majority, said the exchange is the foundation of healthcare. Without these exchanges, we're really not going to reform anything. So to be clear, if you want to stop Obamacare, if you want to stop the federal takeover of healthcare, if you want to stop socialized medicine, what do you need to do? You need to stop the health insurance exchange. So specifically, you need to stop it from being established in your state, from being set up by your legislature. You need to make sure there's no such thing as a Wyoming exchange, a Montana exchange, a Virginia exchange. You also need to make it clear to your legislators that they should not pass a law to make the exchange, to establish the exchange, and that the state should not agree to join with the federal government to operate a federally facilitated exchange. A federally facilitated exchange is an exchange that is basically run by the federal government behind the scenes with a state name and a facade of state control. So let me explain what a health insurance exchange is. I'm going to explain to you what they say it is. I'm going to tell that to you. And then I'm going to tell you what it really is. So they say the health insurance exchange is a simple one-stop shop in each state for buying health insurance. They say the exchange is a new state-established marketplace for buying health insurance. They say it's like Travelocity for health insurance. But I'm here to tell you it's no such thing. A state-established exchange is a federal takeover center set up in your state. It must follow the federal law. It must follow all the federal rules. It must annually report to the Secretary of the U.S. Health and Human Services, and it must comply with any and all requirements issued by the Secretary, including a list of required essential health benefits, and if she should so choose, a list of all the treatments and services that are not going to be available to any of you. There is no state control because there is no such thing as a state exchange. Every exchange is under federal control, or better put, every exchange is part of the national exchange. So I know that a diagram got handed out to you, and it's a diagram of the United States, and I'd just like you to look at it so you can kind of understand what I'm talking about here. So you see that every state has a portal. It's a circle, and a portal is a website. And then what you see are lines that go up to something called a Federal Data Services Hub. And then from there, what you see are lines that go up to a variety of federal agencies. And that's not the sum total of all the federal agencies. So what I want you to understand is the Federal Data Services Hub will transmit your private data in and among state agencies, federal agencies, and employers for tracking and enforcement. So the national exchange is the hub and 50 arms, essentially 50 state-based, federally controlled health insurance exchanges. And the way that you stop the exchange, the way you stop Obamacare, is to make sure you never install one of the arms, one of the state health insurance exchanges. Now, the purpose of the exchange is not what it seems. It is not about selling health insurance. It is actually a registration and enforcement system for national health care. It's the way individuals will annually register their compliance with the Obamacare mandate to purchase health insurance. It is the way that the IRS will track compliance with that requirement and enforce the penalty tax for failure to be insured. It's also the way that 16 million more people will be forced into Medicaid. Every person or their employer on their behalf must go every year to this online exchange, their government's website portal. They must go online to either purchase health insurance or to say that they are exempt from the mandate to purchase health insurance. So this is the registration. The way you register is you either buy health insurance, you're forced into Medicaid, or you register your exemption to the mandate. Now, what if you don't register? What if you never go online? You never go and say anything, right? Well, a bureaucrat in Minnesota told me that they are trying to figure out which state databases to use to pre-populate the exchange. That means that they're trying to get every person's name and information into the exchange before you even register. So clearly, the plan is that they will not only track who registers and for what, but they will be able to track who doesn't register. And then they will go after them to find them and to find them and to fine them, or to force them into Medicaid. Speaking of which, the fine for not being insured, this was just recently revealed by the CEO. They found that this tax for not buying health insurance is going to be now paid by 2 million more people than they originally estimated, and that it will bring in $3 billion more every year than they originally estimated. But I'm here to tell you that I think it will be way more people who choose not to be insured and a whole lot more revenue coming in from this tax. Because some have said this is going to be sticker shock, especially for the young people who are going to be forced by their premiums to pay for the old people. So I think a lot of people will simply just pay the fine and not buy insurance, and then when they get sick, they'll go buy the insurance because now insurance companies have to give it to you. So now, back to the exchange. The amount of data available on the exchange and to the IRS for enforcement is unprecedented. According to the Minnesota contract signed by an exchange developer and the state of Minnesota, Minnesota agencies will provide the developer with all sorts of data on individuals, including the following: public data, private data, non-public data, confidential data, chemical health records, electronic medical records, personal health information, tax records, and other records. The exchange will be a massive database on the American people, a database that people must annually report to. No such database exists in this country today. And once they have it in place, I believe that this national tracking system could be used for far more than imposing a national healthcare system on us. Now, I also want you to know that the exchange is not just about buying insurance or tracking compliance. It is also required by law to be used to ration care. It is required to, under Obamacare, the exchanges are required to make sure that all plans selling health insurance on the exchange must improve the quality of health care. So you see, it's not just about health insurance, it's actually about the delivery of medical care. So they will be tracking what happens between you and your doctor. The question you should ask yourself is, how do they define improve and how do they define quality? In short, they will be using their access to your medical records to control and penalize your doctors for not practicing according to government standards and government directives. This will lead to standardized care and healthcare rationing. Let me share a few things from Minnesota, which is considered to be the state farthest along in building an Obamacare exchange. Governor Mark Dayton, a Democrat, cannot be bothered with the law, the legislature, or the Constitution. He's working for President Obama and not the people. So as a result of our efforts the last 2 years, state legislators have refused to establish an exchange. So Dayton issued an executive order to design and develop it. There are now 12 staff working on it. Well, the Minnesota Exchange staff recently put out draft principles, guiding principles for the exchange. They are quite instructive. The 6 principles are the following, and I'm just going to list the header of them. Number 1, universal coverage. Number 2, high quality, affordable care. Number 3, consumer friendly. Number 4, eliminate health disparities. Number 5, accountable. Number 6, competition. They all sound pretty good, although I bet you don't really like the one universal coverage. Well, if it weren't so serious, it would be rather amusing, because the real principles under the euphemisms are the following. Number 1, national health care. Number 2, ration care. Number 3, government friendly. Number 4, tracking by identity politics. Number 5, accountable to Obama. And number 6, the end of competition. So let's talk about competition for just a moment. I want to read you the exact principle. Here it is. The task force will develop the exchange in a way that fosters vigorous and fair competition in the healthcare system among both providers and payers. Well, this sounds nice, but it's all euphemism. The plan is to eliminate all competition in the healthcare system. The plan, according to Joel Arrio, the person who used to head up Obama's exchange office when he came to Minnesota and talked, he said the plan is that eventually everyone will buy health insurance from the exchange. Everyone. This means there will be no market outside of the government-established exchange. The only insurance options will be health plans favored by the government, and there will be nowhere else for you to go. And from that point, single payer will become very easy. So I want to just let you know something about Joel Arrio before I move on. Joel Arrio, as I said, was in Obama's office. But now, Joel Arrio works at Levitt Partners in the exchange division, going around the country trying to put in exchanges. Levitt Partners is owned by Michael Levitt, and Michael Levitt is now heading up the transition team for Governor Romney. So it's something for you to think about. The two people who have started exchanges, Romney and Levitt, are now working together, and the person who helped Obama put it in is now working for Levitt. So the exchange, going forward, the exchange has been called the centerpiece, the linchpin, the cornerstone of healthcare reform. The exchange has also been called the heart of healthcare reform. Now, I don't know about you, but if I'm facing a beast in the room that I want to kill before it kills me, I do not chop off its little toe. I aim at its heart. So if we want to end permanently the beast that is called Obamacare, we must aim at its heart. And its heart is the health insurance exchange that they want to set up in every state. So any and all government-established exchanges must be defeated. And if you don't succeed, it will be like a lobster trap. Once the exchange is up and running and you're in it, there will be no way out. Now, some of you may have heard that Obamacare requires states to set up an exchange. But that's not true. The federal law says states shall set up an exchange, but because that would be an unconstitutional commandeering of the state, there's a fallback plan, and it's called a federal exchange. But fortunately for us, the administration never gave itself money in the law to build a federal exchange. They thought states would just bow and build them. And so a few have, 13 are moving that direction. So they've asked now for